Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be the host for today's show. We're here at Wellness Associates in Pittsburgh, Pennsylvania with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. On today's episode, we want to talk about the problem of pain management. We had one of our viewers write in about they've been having this kind of chronic pain for a while. They've been to various doctors. They've just been recommended to go to a pain management specialist. And they wanted to know, like a lot of people today, can chiropractic care make a difference in this kind of pain cycle they're in and this chronic pain problem?
See, to me, chiropractic is the perfect alternative to taking drugs, because when you take a drug for pain, it just masks the symptom. It doesn't actually correct why you have the pain. The pain is the red light on the dashboard telling you to pull into the Exxon station, look under the hood to determine the cause of why you have the red light. So that's what we do. We get to the cause of why you have the pain. Usually, Jerry, my experience in almost 30 years of practice, it's usually due to a pinched nerve. So if you have a pinched nerve, that's causing your pain. It's hard bone out of position pressing on the nerve. Okay, even fibromyalgia, they're determining it's coming from the spine. Okay, so if you have hard bone out of position pressing on soft nerve, that causes pain. And what we do is we relieve the pressure on your spine, spinal cord pressure, with a specific chiropractic adjustment. 9 times out of 10, that relieves your pain. So you don't need to go to a pain management specialist, because you don't need the drugs, because we're getting to the cause of why you have the pain, and we're correcting it, and the key word is we're fixing it.
Yeah, it almost seems to me that a lot of these protocols that are taking place, it's almost where they're just trying to mask the problem, as we talk about, versus really fix anything.
Right.
It's almost like I think the term that they use a lot of time is they want to get the pain to a tolerable fashion, where you're saying you could make a difference and a person could literally be pain-free.
Getting into a tolerable position, that's not acceptable for
right.
you, because we want to go further than that. We actually want to get it 100%. We want to fix it. We want to correct it. Okay? Because also the drugs, yeah, let's say you get it to a tolerable point, there's side effects to the drugs. Every time you take a drug, that's going to affect your liver and your kidney. So it's a trade-off to me. Yeah, you get rid of the pain, but then you have another condition from the side effects from the pain, from the drugs. That's not acceptable to me.
Yeah. And correct me if I'm wrong, but a lot of times as you're taking these medications, once you take them for so long, your body almost becomes
That's correct.
used to that, so now you need a stronger pill.
You start tolerating it, you get immune to it. And so it's like alcohol. The more alcohol you take, you get immune to it. You need more alcohol. So it's the same with drugs. You take drugs, you get immune to it, you tolerate it, and then you need more drugs.
Yeah.
So that's not acceptable to me, Jerry.
Well, and I would think also that, when you just talked about the alcohol problem, from what I've seen in doing some research and talking to people, because of dealing with this chronic pain for so long, unfortunately people turn to these other arenas, and now that just adds a whole nother problem.
The pain affects your whole life, because it affects you emotionally, affects your relationship. It can depress you. It can make you irritable. It affects your whole life. Okay? So to me, it's not acceptable just to tolerate pain and to be popping pills, because you're not getting to the root cause. It relates back to the red light on the dashboard. Now, you take better care of your car, you pull it into the Exxon station to see why you have the red light, but you ignore your red light in your body, which is the pain. So your body's your friend, Jerry, and if you know that, it's communicating with you. And it doesn't know English. It only knows the language of pain. It's getting your attention. So we say in chiropractic, Jerry, we say, listen to your body.
I think too many people are putting that piece of tape over the red check engine light, so they don't see it.
That's exactly right. It's the same with the fire alarm. If your fire alarm went off, you wouldn't kill the battery in the fire alarm. Right. You would get to the cause of why you have the fire alarm, because of the fire.
Right.
So it's the same thing.
Well, as always, when we're on these shows, we always want people to understand that, there are other options. There are other areas of treatment that people need to start to look at. Too many people, I think, are locked in to, say, one physician. That they think just, whatever he says goes. And I think what people need to understand is they need to take the active role, take responsibility for their health, look at alternatives. If your doctor that you go to right now gets upset because you want a second opinion or want to look at another form of treatment, I think you should definitely leave
I agree.
that doctor. Because if they're not open-minded enough to say, let's get everybody working together to help do what's best for this patient, I don't think you're in the right situation to start with.
Yeah, because see, you have more heads than one, the patient benefits. If you have a holistic clinic where you have all the options, like you said, that's benefit for the patient versus you have one cause, one cure, everything's a drug for everything, and then the patient wants an alternative. The patient has to seek that out themselves, whether they go on the internet, do the research. I mean, thank God for the internet, because that's given the people the freedom to get the information. Access to information, to me, Jerry, is power. It gives people the power back in their own hands, and they're educating themselves. Okay, that's what makes this great.
And along those lines, we just want to make sure, if you haven't visited the website yet, go to AskDrGoldberg.com. I know Doc puts up some great posts every week on various problems. Maybe you're not dealing with a pain management issue right now, but you have some other type of problem. There's some great information on there, great free information. And we can't stress enough that, how Dr. Goldberg offers a new patient free evaluation. I mean, so if you have a problem going on right now, they can pick up the phone, come down here, get to meet you, talk to you, kind of see what things the facility can offer to them. And I think you'll be amazed at what is available here and the impact that the knowledge and the treatment protocols that Dr. Goldberg will put together for you, how that can impact your life. So if you're sitting there right now and you're frustrated with the situation, you're not getting results like you would like to, take an active role in it, pick up the phone, give Dr. Goldberg a call, come on down, see firsthand what he can do for you. So with that, we really appreciate you taking some time to watch our show today. We hope you have a little understanding of this whole pain management problem and how chiropractic care can impact it. And we hope that you'll take the time to just come down and visit Wellness Associates and let them have an active role in your health and wellness. So have a great day, and we look forward to seeing you on our next video.